So what is really going on? You hear it all the time, right? Record funding for the NHS. But then the reality you see is just long waits, stretched services, a system at its breaking point. Where is all that cash actually going? And why isn't it fixing the problem? That's the core question we need to answer.
Okay, let's start with the money itself. The annual budget for the NHS is now over £200 billion. That is a historic all-time high. I mean, in actual cash terms, it's more than doubled since just 2012. So, this idea that the service is simply starved of cash, well, it's a bit more complicated than that.
But here's the real kicker. With all that money being pumped in, satisfaction with the NHS is at its lowest point ever. Barely 1 in 5 people think the service is good. So it's pretty clear, isn't it? The problem isn't just about how much money we're spending, but how it's being spent. And that brings us to a huge, fundamental shift in the way the NHS works. To really get to the heart of this, we've got to look under the hood. Because over the last decade or so, a series of reforms introduced a pretty radical new idea. What if we turned parts of our public health service into a kind of internal marketplace, one driven by private sector incentives? Well, this, right here, is the moment everything began to change. And the big turning point was the Health and Social Care Act back in 2012. Before this, the NHS was, mostly a public system. But this law just opened the floodgates. It wasn't just about a little friendly competition. No, it completely rewired the system to favor private companies. And, get this, it allowed NHS hospitals to make up to 49% of their money from private patients. Almost half.
And this creates this massive, fundamental conflict right at the heart of the NHS today. On one side, you've got the founding mission, healthcare for all, free at the point of use, based on your need, not your ability to pay. And on the other, you have the constant, relentless pull of the market, which is all about profit and shareholder value. It's like two different worlds colliding, and that collision is happening inside our hospitals every single day.
So what did this new market-driven approach actually look like in practice? Well, it looked like a tsunami of outsourcing. Since 2012, a truly staggering £125 billion of public money has been handed over to private companies to run NHS services. To give you some scale, that's more than half the entire annual NHS budget. It's a colossal shift of our resources from the public sector to the private one. And all of this has a very real, and let's be honest, a very worrying consequence: the quiet creation of a two-tier health system. A system where the care you get isn't just about how sick you are anymore, it's about who you work for and what kind of private insurance you might have. And you can see the effect crystal clear right here. As those NHS waiting lists have just skyrocketed, so has the number of people with private health insurance. We're talking a 30-year high, with almost 5 million people now covered by their employers. It's basically creating a fast lane. If you can afford it, or your job provides it, you can buy your way out of the queue. But what about everyone else?
And this table just lays the divide bare. For high-paid tech workers, professionals, private insurance is pretty common. But for essential staff, the cleaners, the porters, the care workers who literally keep the country going, it's almost unheard of. This is creating a clear class-based divide in who gets access to timely care, and it just completely undermines the core principle of the NHS.
But it's not just about fairness and inequality. This fragmented system has created something maybe even more dangerous, what you might call an accountability black hole. I mean, when you have this messy mix of public and private providers, all with different bottom lines, who is actually responsible when things go wrong? Who do you turn to? And if you think the official complaints system will help, think again. It is frankly completely broken. The vast majority of people who have a bad experience don't even bother complaining anymore. Why? Because they've just lost faith that anyone will listen or that anything will change. And with a 2-month wait for even a basic response, who can blame them? And the human cost of this accountability vacuum is just devastating. The case of the Tees, Esk, and Ware Valleys Trust is a truly tragic example. Multiple young people died while in the care of this trust, and their families have been left fighting for years, just trying to get answers, convinced that systemic failures are to blame. And this is the soul-destroying journey so many families go on. A family raises an alarm. But look at step 2. The trust conducts an internal investigation. This is the accountability black hole in action. The organization investigates itself. How is that supposed to be impartial, especially when that same trust can profit from private care? Even when coroners step in with official warnings, the result is almost always the same: delays, inadequate responses, and a total failure to learn. And this might be the most damning statistic of all. When a coroner finds a death was preventable, they issue a report to make sure it never, ever happens again. But as you can see, nearly a quarter of those life or death warnings are met with nothing. Crickets, complete silence, no response, no action. It's a system failing to protect us from preventable harm.
So when you put all of this together, the market incentives, the two-tier system, that terrifying accountability black hole, you're not just looking at a few policy problems. You're looking at a full-blown systemic crisis. And some are now arguing that this goes beyond politics. It's actually a constitutional crisis.
See, the key thing to understand is that the original NHS Act isn't just any old law. It's what's known as a constitutional statute. That's a big deal. It means it establishes a fundamental duty on the government, a duty to provide a comprehensive health service for everyone. And that duty can't just be ignored or chipped away at by later policies. And this quote just nails it. The NHS isn't just a nice-to-have service. It's a fundamental promise from the state to its people. The argument here is that by allowing the service to be fragmented and commercialized, the government is essentially breaking that sacred promise.
So, where does this leave us? Well, the sources we've explored don't offer any simple, easy fixes. Instead, they leave us with a pretty stark call to action, that these problems are now so deep, so fundamental, that they can only be resolved at the very highest level. The future of the NHS, it seems, won't be fixed in hospitals, but in the halls of Parliament. And that leaves a big question for all of us, doesn't it? What kind of health service do we really want, and what are we prepared to do to get it?